I'm Maura Carley, founder and president of Healthcare Navigation, and today we're going to talk about selecting a Medicare supplement plan. And I often say there's an exception to almost everything I say. And I, I do want to clarify something from the last video. We recommend that virtually everyone on original Medicare buy a Medicare supplement. Remember, you don't get one if you're on an Advantage plan. However, there are still people who have good retiree medical. And if you still had good retiree medical through a former employer or union, then you wouldn't also get a supplement. It's just that good retiree medical is much rarer than it used to be, and is usually what people who retired from government have, for example. And in the private world, most retiree medical, where it exists, has either been structured as an Advantage plan or takes retirees to a private exchange where they choose among a subset of supplements, Part D plans, and Advantage plans. So let's move on and talk about the system in the 47 states. Again, we're not including Massachusetts and Minnesota. They have their own approach with fewer choices, which I think is fine. And Wisconsin is totally different. So I'm sorry, Badgers, we're not going to address Wisconsin today. But let me go back and say that it used to be that the scheme of supplements presented in a way that was more rational. You had plans A through J, A having the least benefit, J having the most. And that's what you had for many, many years. Then Part D began in 2006, as we've already discussed. Well, supplements H, I, and J contain drug coverage, and you had to choose. You could keep them, or you could go on Part D. But ultimately, those plans were removed as a choice. So we still find some people who have the old Plan J, but someone new to Medicare can't buy it anymore. And then in 2010, more plans were added, and as well, some others have been deleted along the way. So right now, there's, for most people, 9 plans to choose from. And if you were on Part A prior to January of 2020, you could still buy a Plan C or a Plan F. Now, if you're new to Medicare, you would be looking at Plan G as your richest benefit with the most coverage, if that interested you. And the difference between Plan F, which used to be the richest plan for everybody, and Plan G is just the Plan F covers the Part B deductible, which is now $203. In our opinion, Congress passing legislation so that people could no longer buy a Plan F or a C, it just seems sort of silly to me. The rationale was that if people have first dollar coverage, meaning you pay your premium and all your Medicare Part A and B services are paid for between Medicare A and B and the supplement, that people would be running to the doctor and overutilizing medical services. And if that were the case, then the Part B deductible should be much higher than $203 as it is now, which is very modest. But there's always that healthy debate between encouraging access and discouraging overutilization. So That is what it is. Honestly, if you have a plan F or a plan C, you can keep it. And but if you were going to consider changing to a plan G, which is likely over time to be a better financial option than F, because once you close an insurance product to new enrollment, premiums do tend to escalate at a faster clip. But as we have covered in the past, the guaranteed issue period for Medicare supplements is 6 months after the effective date of your Part B. And after that, in most states, if you apply, your plan can subject you to medical underwriting, which is requiring you to fill out a questionnaire. And if you have pre-existing conditions or are taking drugs that result in them not wanting to enroll you, they are not obligated to. New York, Massachusetts, Connecticut, and Maine have more protections for consumers, but in most states, if you were on Plan C, or Plan F is much more common than Plan C, but if you were on either of those, again, you can keep them, but in most states, if you were to change now, you would be subject to medical underwriting. So in our view, there's too many choices. I think it's best to look at G, which is the richest, N, which is the second richest, has an entirely different kind of structure. Rather than co-insurance, it's co-payments for doctors who accept assignment, and no additional coverage for doctors who don't accept assignment. So that's a newer plan. That was one of the plans added in 2010. And then, a high deductible G is a good option too. It covers like a plan G at 100% once you've met a deductible of $2,370. So these are all good options. You just have to decide which you are more comfortable with. You want to take it very seriously because not all plans are portable. You want to buy one that is. Most are, but that means you can take it to another state. So that's one issue. And then this other issue is you don't want to have buyer's remorse because you may not be able to change 6 months after your Part B effective date. We are going to try somehow to insert the Medicare supplement chart showing the various plans and the benefits. And then as an example, the page that shows all of the Connecticut options, because Connecticut allows about 13 insurers to sell Medicare supplements, so that information can be displayed on one page. If we can't figure out a way that that works well, then we'll also, of course, include that information in the copy that we send around with our email material. But I include the Connecticut supplement chart because, well, two reasons really. You do want to try to buy a plan that has a reasonable premium, and Connecticut allows plans to have a pretty broad spread. So you can look at Connecticut's chart and see that a Plan G through Anthem is $211 a month, and a Plan G through another carrier, who I won't name, is $600 and some dollars, and that just doesn't make sense. But it's a harder job in some states. Some states control more tightly the number of insurance companies who can sell these things. And of course, some of the small states like Connecticut and Massachusetts allows fewer than 10 insurance companies to sell supplements. And then you have large states like Florida and California with 20 and 30 companies offering supplements, and then Texas 70 some. So you want to be very careful about shopping for these things. You've got to get the right product, the right insurance company, make sure it's portable, and make sure you don't have buyer's remorse. So take your time, but make your decision wisely. I hope this was helpful. Thank you for listening. Take care.